Normally, the first person to be notified when your child loses a tooth is the tooth fairy. But because kids are clumsy, head heavy, and fall face first, they may knock out a baby tooth before it's time or lose a permanent tooth that they are gonna need. What most people don't know is that even if your child's permanent tooth is completely knocked out, you may be able to save it by reinserting it. So stay with me and I will teach you how. There are 4 types of tooth injuries. 1. The tooth is hit but not loose. The child may experience pain when they bite down or if you tap the tooth. There is nothing you need to do immediately except call your dentist and make an appointment for the next few days. Feed your child a soft diet with the consistency of applesauce for the next 72 hours. 2. The tooth is either pushed in or out or sideways and does not appear to line up with the other teeth. The child should be given only a liquid diet and seen by their dentist within the next 24 hours. 3. The tooth is either cracked or broken. These can be uncomplicated if the crack is on the corner or bottom edge of the tooth. It becomes complicated if the crack runs through the middle of the tooth. In that instance, you will see a blood spot at the center of the crack, and this means that the tooth nerve has been exposed. The child should be given only liquids and seen by the dentist within hours. 4. The tooth is completely knocked out. These are handled differently depending upon whether the tooth is a baby tooth or a permanent tooth. A baby tooth is never replaced. Have the child bite down on a damp cloth to stop the bleeding. If a permanent tooth is knocked out, in some instances it can be saved and safely reinserted. First, find the tooth. Then gently rinse but do not scrub because you will injure the fibers that will allow the tooth to survive. The tooth has the best chance of reattaching if you gently push it back in the socket before going to the emergency room or dentist. Make sure the tooth is facing the right direction. Then have the child hold the tooth in place by pushing down with his finger. If you cannot get the tooth in easily, to keep the tooth from drying out, place it in milk or salt water. Do not use plain tap water as that may affect the healing of the tooth. If the injury occurs when you are away from home and the child is over 12 years of age, have the child hold the tooth under their tongue or in the cheek while you seek medical help. If the child is too young to do that, the tooth may be stored in the mouth of a supervising adult. The sooner the tooth is replaced, the better the result. Follow up with the dentist within hours is a must. Each of these 4 injuries may be associated with bruised or bleeding gums or lips. Remember to carefully clean these other injuries. And now you know the tooth, the whole tooth, and nothing but the tooth.